leaders. The statements surrounding the congressman's condition from both sides of the aisle are creating more questions and curiosity. California Congresswoman Jackie Speier is a member of the Committee on Oversight and Government Reform, and she joins us now. Good day to you.
Good morning.
Talk to us a little bit about Jesse Jackson Jr. Mr. Hoyer said yesterday his constituents would be well advised to know where he is. Do you want to know his location, and how much is this going to affect the Democratic caucus's ability to message on the economy? Will this continue to be a distraction?
I don't think it's going to be a distraction. I mean, people get sick in Congress frequently, and when they get sick, they seek medical care, medical attention. That's what Jesse Jackson Jr. is doing now. I think he deserves to have his privacy. I think his constituents should have a clear understanding of what his condition is, but beyond that, let him recover.
Yesterday, the GOP in the House, the leadership repealed health care reform for the 33rd time. And when we have some recent numbers here from a Quinnipiac poll, it says, do you believe the health care law is in fact a tax hike? Coming off of the Supreme Court, Justice Roberts saying it was. 55 yes, 36 no. How does that play for you in November? Is this going to be a problem for House Democrats trying to win back those 25 seats that America now believes health care reform is a tax hike?
Well, it's not a tax hike. It's really important to realize that less than 1% of Americans are going to be paying this penalty for not carrying health insurance. You know, let's remember that 3 people an hour die in this country because they can't access health care. 26,000 a year. What this law is going to do is make sure that people get the preventative care they need so that they're not going to have the extraordinary care associated with advanced cancer, that they'll go to the doctor when they need to, regardless of how much it's going to cost, because there's going to be a means by which they can pay according to their income.
We look further into this poll, and one of the reasons for that I heard from GOP aides yesterday is the reason why they were doing this for a 33rd time was to appeal to independents. When it's asked, should Congress try to repeal the health care law, all voters say should repeal it 49 to 43, independents 49 to 41. So you have a majority of independents saying that this law should not be in there. Are Republicans gaining by associating themselves as the party with repeal? Are they gaining with independents in this very close election?
Well, actually, I don't believe so. A Kaiser Family Foundation poll that was released yesterday says that the American people believe that we should get on with creating jobs in this country. And I think if you ask the American people, do you like the fact that now your kids can stay on your insurance policy until they're 26? Do you like the fact that you don't have a copay now when you go in for a mammogram or a colonoscopy, that that's not money out of your pockets? They say yes. Do you like the idea that if your child has a pre-existing condition, they can get health insurance? When you ask them the specifics of the law, they understand it, they like it. We need to do a better job of messaging how much better it's going to be, how many lives are going to be saved, and to focus on the fact that our outcomes in this country are worse than they are in virtually every other industrialized country with the health care system we have today.
Has the messaging been subpar so far from House Democrats on the health care issue?
I don't think it has been as good as it should be. And I, for one, believe we should be, screaming with great interest and enthusiasm what the American people are gaining. You know, when Social Security was created, when Medicare was created, they were all found to be less than optimal until you receive the benefits and fully appreciate what you're really getting.
And lastly, real quick, your majority, obviously, almost 2 years ago, you had huge margins in the House, so almost 60 in the Senate for some time, a Democratic president. Looking back on it, do you feel that you guys should have paid more attention to perhaps some economic programs like the Tennessee Valley Authority or some infrastructure things instead of health care reform, that it would have been better for you politically?
I do think that we need to take a page from President Roosevelt's book when he, as a brand new president, came in and within 3 months created 3 million jobs by creating the TVA, CCC, WPA, all those various programs. Now, they didn't work in the short term. It took 5 to 7 years, and frankly, we weren't out of it until World War II. But yes, we are focused on creating new jobs, and we want to work with our Republican colleagues to create those jobs.
Jackie Speier from California, thanks so much for joining us this morning. Take